particular lecture is going to go over Chapter 3, Integrating Public Health and Physical Activity, kind of putting our last two chapters together. Again, these lectures are just kind of some short information, some introductory material to what you're going to be looking at in these chapters. Make sure you're looking at the book and kind of reading those for yourself to fill in any gaps. But this particular chapter is going to kind of put the last two together, kind of give us a connection between those. And so you're going to look at the history of physical activity and public health and how those translate together and the application between those. And you're going to want to know what is the interaction between kinesiology and public health and why is defining that so important, kind of what we're looking at here, and all of these things as we move forward. And so where we start is we want to look at something, it's called a route master bus, but buses are a big thing in many places, but especially in England. And so studies were done over time with public health, looking at kind of what happened and what we noticed over time. Well, I say what we noticed, what some people noticed over time. Was that depending on what their role was with buses and what went on, we could start to see that there were some connections between coronary heart disease and London bus drivers / conductors. So the people who actually drove the bus and the people who kind of directed those buses. And so what you see here is you see different kind of heart conditions at the bottom. So all heart conditions or coronary heart disease, and then fatal heart attacks and non-fatal heart attacks and angina or chest pain. And it's looking at how many occurred per 1,000 people that were in here. And what you start to notice when you look at this is that the drivers in heart attacks had much higher rates than conductors did. Now, conductors had higher rates of angina, chest pain, but all of these were kind of looking at, and you're saying, well, why? Why are those things happening? And conductors tend to move around a little bit more, where drivers might not get up and move quite as much. And so there starts to be this connection of physical activity and a link to public health. And so these were some of the doctors that were involved, and they were able to help notice these things and to start helping make changes. And so what you see is that these subdisciplines started to occur over the last year. So we started with public health science and exercise science kind of starting at the same and being slightly related and having connections, kind of like what we just showed. And then you start having population studies and behavioral sciences and environment and policies being looked at. And so they're all related, they all stack on these, but at the same time, like they realized that there was a need for something more based on the data that was being driven, that exercise science couldn't necessarily change the environment, but other people could. And so what you see is the reason for some of these things moving the way they have is because the things that are killing us are much different today than they were back in 1900. And so when you look at the top 10 things that killed people in 1900, they are things like pneumonia, tuberculosis, diarrhea, syphilis, things like that. And so you start getting a lot of infectious diseases. There are some other things, disease of the heart, that weren't as defined. But in 2015, the top things are all kind of to do with our health style instead of diseases that were killing us. So heart disease, cancer, the choices we make, the inactivity that we're doing, chronic lower respiratory diseases, accidents, strokes, Alzheimer's disease, diabetes. And so that really starts to paint a picture of how these things have progressed over the years and why they look different than they did 100, 120 years ago, but also how they're still related and how they are definitely necessary. So public health surveillance is really just looking at everything to try to figure out what's affecting the public's health, and is really used to help plan and implement and evaluate health practices to see if they're working. And so that surveillance can help lead to finding things like the bus and then trying to figure out how can we make those better. And so over time, over quite a number of years, people have been surveilled about their physical activity, and so they've come up with ways to things that people can do to improve their physical activity, or minimal recommendations to help people become healthier and not have to worry about some of these leading causes of death. And so in 2018 were the most recent physical activity guidelines, and these work specifically for Americans, but they really could go across almost everyone. But they're broken up into adult and then children or adolescents, and they kind of define those. Children less than the ages of 6 don't have a lot of recommendations set in stone, but definitely encouraging physical activity is always a plus. But children, adolescents should do an hour or more a day of physical activity. Most of that hour should be moderate or vigorous intensity. They should be doing muscular and strength training activities 3 days a week, and 3 days a week of a higher intensity, of vigorous intensity. The higher intensity is definitely much better for them as they go. For adults, we see that those change a little bit. Adults tend to be able to see health benefits through a little less physical activity, but that doesn't mean they should just cut back altogether. It's just trying to encourage people to at least get the minimums. Adults should do about 2 hours and 30 minutes a week of moderate, or an hour and 15 of vigorous intensity. That comes out to be about 30 minutes a day of moderate intensity. They should, when doing aerobic activities like running, walking, jogging, swimming, do it in bouts that are at least 10 minutes long, and preferably spread those throughout the week. So you don't want to, on Saturday get 2 hours and 30 minutes of exercise going out and playing soccer or basketball and then do nothing else the rest of the week. We would really like to see that spread throughout the week. Additionally, we know that if you go up to the 5-hour mark, the 300 minutes, or about an hour a day of moderate, or 2.5 hours of vigorous, that we see even more benefits. And adults should also incorporate muscular strength training activities at least 2 days a week, in addition to those other physical activity recommendations to be healthier. And so we see those. And then older adults also have suggestions as well. They should really follow the adult guidelines, but they may want to do things that may have to modify workouts. They might not be as open to as many things because of certain health conditions, but they definitely want to avoid inactivity, and they definitely want to do things to help with their balance and stability for risk of falling, and really making sure they're focusing on strength, because most people, as they get older, their strength tends to decrease, and we definitely want to try to stave that off. And so those are the general recommendations that we have for Americans and their activity. And so a lot of this comes back to looking at different ways to affect people's physical activity. Not as big of a concern, but it's definitely something we want to look at. And so we know that really it comes down to an individual to affect their own physical activity, but things that do affect that would be environmental factors. So what is the temperature? Do they have access? And we know that policies make a difference as well. And so really when we look at these, we have to somehow get down to that individual, and that could take policies that affect the environment, which also even affect the social people around them. It's hard to see right there. They didn't do a great job of making that visible. But really looking at that model and how that's going to be integrated into helping someone change their physical activity. And so what you can see is that physical activity is really, it's relevant in public health, and it takes a lot, and it's not the easiest thing to implement because of so many factors and how it's individual, but we need some general recommendations, and you can see they're very broad. But you're going to kind of look over that chapter and be able to start making that connection of physical activity and public health. And then make sure you go on and look at some of the review materials as well that will kind of make some of these connections to public health and the things that are going on. So hopefully you guys are enjoying some of these readings so far, and you're finding these lectures helpful. Please let me know if you have any questions.